Rivastigmine is a medication that is widely used in the treatment of various conditions, delivering much-needed relief to patients. While it is primarily prescribed for Alzheimer's disease and dementia, it also shows promise for other cognitive impairments. This versatile drug works by increasing the levels of certain chemicals in the brain that are responsible for memory and cognition. Main conditions addressed by rivastigmine. Rivastigmine is primarily prescribed for Alzheimer's disease and dementia, two conditions that are characterized by progressive cognitive decline. Alzheimer's disease is the most common form of dementia, affecting millions of people worldwide. It is a neurodegenerative disorder that leads to memory loss, confusion, and impaired thinking. By increasing the levels of certain chemicals in the brain called acetylcholine, rivastigmine helps to improve cognitive function in patients with Alzheimer's disease. It can help to slow down the progression of symptoms and provide some relief for both patients and their caregivers. In addition to Alzheimer's disease, rivastigmine has also shown potential for other cognitive impairments. It may be prescribed off-label for conditions such as Parkinson's disease dementia, Lewy body dementia, and vascular dementia. These conditions share similarities with Alzheimer's disease and can benefit from the cognitive enhancing effects of rivastigmine. Dosage recommendations for rivastigmine. The dosage of rivastigmine is individualized and should be determined by a medical professional based on factors such as the patient's condition and tolerance. It is available in different forms, including oral capsules and transdermal patches. For Alzheimer's disease, the recommended starting dose of rivastigmine is usually 1.5 mg twice a day. The dosage may be increased gradually, based on the patient's response and tolerability, to a maximum of 6 mg twice a day. It is important to follow the prescribed dosage and not exceed the recommended limits. When using transdermal patches, the initial dose is typically one patch delivering 4.6 mg of rivastigmine per day. The patch is applied to the skin and should be changed every 24 hours. The dosage may be increased to 2 patches delivering 9.5 mg per day, based on the patient's response and tolerability. It is important to note that dosage adjustments may be necessary for patients with liver or kidney impairment. Close monitoring by a healthcare professional is essential to ensure the optimal dosage is achieved. Potential side effects of rivastigmine. Like any medication, rivastigmine can have potential side effects. The most common side effects include nausea, vomiting, and gastrointestinal issues such as diarrhea and stomach pain. These side effects are often mild and can be managed by taking rivastigmine with food or adjusting the dosage. If the side effects persist or become severe, it is important to seek medical advice. Other potential side effects of rivastigmine include dizziness, headache, fatigue, and muscle weakness. These side effects may vary in severity and frequency depending on the individual. It is important to report any unusual or persistent side effects to a healthcare professional for further evaluation. In rare cases, rivastigmine may cause more serious side effects such as severe allergic reactions, heart rhythm changes, and hallucinations. If any of these symptoms occur, immediate medical attention should be sought. It is important to weigh the potential benefits of rivastigmine against the potential side effects. Many patients find that the benefits of improved cognitive function and quality of life outweigh the mild side effects they may experience. User feedback on rivastigmine. User feedback on rivastigmine has been largely positive, with many reporting significant improvements in memory, cognitive function, and overall quality of life. Patients and their caregivers often share stories of how rivastigmine has helped to slow down the progression of Alzheimer's disease and improve daily functioning. One user reported, "Since starting rivastigmine, my mother's memory has improved, and she is more engaged in conversations. It has made a noticeable difference in her quality of life and our ability to communicate effectively." Another user shared, "I have been using rivastigmine for a few months now, and I have noticed a significant improvement in my memory and ability to focus. It has made a big difference in my daily life, and I am grateful for this medication." It is important to note that individual experiences may vary, and not all users may experience the same level of improvement. It is always recommended to consult with a healthcare professional before starting any new medication to determine if rivastigmine is the right choice for you or your loved one. Alternatives to rivastigmine. While rivastigmine is a widely prescribed medication for Alzheimer's disease and dementia, there are other alternatives available. These alternatives include other cholinesterase inhibitors such as donepezil and galantamine. Donepezil, like rivastigmine, works by increasing the levels of acetylcholine in the brain. It is available in different strengths and is usually taken once a day. Galantamine also enhances the effects of acetylcholine and is available in both immediate release and extended release formulations. The choice of medication may depend on several factors, including the patient's response to treatment, tolerability, and potential drug interactions. It is important to discuss the options with a healthcare professional to determine the most suitable treatment approach for each individual. Precautions and contraindications for rivastigmine. Before starting rivastigmine, it is important to inform your healthcare professional about any pre-existing medical conditions, allergies, or medications you are currently taking. Certain conditions may require caution or monitoring when using rivastigmine, including liver or kidney disease, heart problems, and gastrointestinal disorders. Rivastigmine is contraindicated in patients with a known hypersensitivity to the drug or its components. It is also not recommended for use in patients with severe liver or kidney impairment. It is important to follow the prescribed dosage and not exceed the recommended limits. Abrupt discontinuation of rivastigmine should be avoided, as it may lead to a worsening of symptoms. How to take rivastigmine properly. Rivastigmine should be taken exactly as prescribed by a healthcare professional. It is usually taken with food to help reduce the risk of gastrointestinal side effects. The oral capsules should be swallowed whole and not crushed or chewed. When using transdermal patches, it is important to follow the instructions provided. The patch should be applied to clean, dry, and hairless skin on the upper or lower back, upper arm, or chest. It should be changed every 24 hours, and a different site should be used for each application to avoid skin irritation. It is important to adhere to the prescribed dosage schedule and not miss any doses. If a dose is missed, it should be taken as soon as remembered, unless it is close to the time for the next dose. In such cases, the missed dose should be skipped and the regular dosing schedule should be resumed. Frequently asked questions about rivastigmine. Can rivastigmine cure Alzheimer's disease or dementia? No, rivastigmine cannot cure Alzheimer's disease or dementia. It can help to improve cognitive function and slow down the progression of symptoms, but it does not reverse the underlying causes of these conditions. Can rivastigmine be used in combination with other medications? Rivastigmine may interact with certain medications, including anticholinergic drugs and medications that affect heart rhythm. It is important to inform your healthcare professional about all the medications you are currently taking to avoid potential drug interactions. Are there any lifestyle changes that can complement the use of rivastigmine? Yes, maintaining a healthy lifestyle can complement the use of rivastigmine. This includes engaging in regular physical exercise, eating a balanced diet, getting enough sleep, and engaging in mentally stimulating activities. How long does it take for rivastigmine to show results? The effects of rivastigmine may vary from person to person. Some individuals may notice improvements in cognition and memory within a few weeks, while others may take longer to respond to the medication. It is important to be patient and give the medication time to work. Can rivastigmine be used in pregnant or breastfeeding women? The safety of rivastigmine in pregnant or breastfeeding women has not been established. It is important to consult with a healthcare professional before using rivastigmine in these situations. Conclusion and final thoughts. In conclusion, rivastigmine is a valuable treatment option for Alzheimer's disease, dementia, and cognitive impairments. With proper dosage and monitoring, patients can experience improved cognitive function and enhanced quality of life. It is important to understand the recommended dosage, potential side effects, and user feedback before starting rivastigmine. As with any medication, it is always recommended to consult with a healthcare professional to determine if rivastigmine is the right choice for you or your loved one. By understanding the benefits and considerations of rivastigmine, patients and their caregivers can make informed decisions and strive for better cognitive health.